At this point, we are going to get started. I will introduce myself, and I will also introduce our upcoming presenters. My name is Joseph Glazer. I am Deputy Commissioner of the Department of Community Mental Health, and I am also the head of the County School Reopening Work Group. Following some changes that have occurred in the last few weeks, it was decided that it was time for us in the Westchester County Department of Health to assist the school community by reviewing some of the questions, some of the issues that are arising around school reopening and issues relative to everything from isolation to testing to the new New York State DOH toolkit. So we will be taking a look at all of those things as we go forward. What we're doing first and foremost is we are recording this because we will, in fact, there are people who are still trying to sign on and we've reached the maximum. We will be recording this. We will turn it into a webinar as we have previously, and we will be sharing that with everyone, not only through our website, but we'll also put it back out through the network in which we notified individuals of this event. So we will be making the link to that available. It'll probably take a few days to turn it around, particularly to the fact that this is the holiday weekend. So to move forward quickly, our two presenters are Dr. Dial Hewlett and Dr. Ada Wong, who have both been leading the effort to deal with COVID response and assisting the schools in doing so. I will be bringing up a PowerPoint presentation, but I believe Dr. Wong is going to introduce herself and get started. Thank you.
Hi, Joe. Thank you. Can you all hear me?
Yes.
Okay, great. Yeah, so I'm Dr. Ada Wong, and I'm the Deputy Commissioner for Disease Control here at the Westchester County Health Department. I'm also an infectious diseases physician, and we've all been, working.
And to come.
I'm sorry. Anyway, so we've all been, working to try to update, and give you information. As Joe mentioned, there have been a number of updates. So the basic, sequence or what we wanted to cover today is just one, give you the guidance that has been developed by the New York State Health Department, for school procedures. And then two, we wanted to give you some Westchester contact information and just procedures there. Then we also wanted to outline the responsibilities and roles for the school and for the Westchester County Health Department for positive cases and reporting. And then we did want to go through the major updates in the school toolkit, which hopefully all of you have had an opportunity to review. Those were released late last week. And then finally, open it up to questions. So if we can go to the next slide, Joe. So again, a number of documents have been developed for trying to provide guidance. Most of you are familiar with the guidance that came out this summer that in the New York Forward website, and that was updated, I think, around August 26th or 27th with some supplemental materials. But we really encourage you to refer back to that because the state does give its guidance there. Then the second important document is the document which was the school toolkit. We received it on the 1st. I think it might have been dated on September 30th. These were really developed by the State Health Department in response to a lot of the questions from you, from the schools, but also from us as the local health department. And really, if there is, a disparity between the August written guidelines and these charts on October 1st, the latter documents really supersede any type of previous guidance. And the recommendation would really be for you to update any of your school policies, procedures, and materials to be consistent with the updated guidance. Then the other thing is that all of you, I believe, had the opportunity or were invited to a reporting webinar done by the State Health Department. And again, all of you, I believe, are familiar with the school report card dashboard. And so I think this was done on a couple of different occasions, on the 8th for the public schools, and then on the 14th again for the private schools. And again, the link to this training and the slides are noted here. And then finally, what I do want to emphasize is this is the New York State Health Department guidance, which we here at the local health department, just as much as you are subject to. We're not the ones who write the guidance or have, really, and so we have to adhere to this too. And so what I would really encourage you to do is, with any questions that you have, is to please submit that to that email box. You can, of course, contact us too, but I would ask and encourage you to put it through, that email box as well, in order to improve, I think, all of our chances of getting some sort of a response. And we do, I think, Joe, there is a plan to get these slides out, right, and get this out to all the participants, or it'll be posted, with the recording, so that these will be available to you. Next slide.
Dr. Wong, I'm sorry, but to follow up on that, yes. We will also put the slides out when we put the webinar together. We'll include the slides. But the other thing that I forgot to mention, so I'm glad you kind of segued to me very briefly, is if you have any questions now as we're doing this presentation, please send them to me. You can share them with everyone in the chat box. We will take notes of those, and we will moderate the questions and review them and answer them at the end. Thank you, Dr. Wong. I'll move on now.
Okay, so next slide. Just a reminder, this has been the procedures all along, but any either staff or student that you hear about who has tested positive for COVID really should be called into us at the 813-5110 number. This number is operational during work hours, 8:30 to 4:30, and it is staffed 2 days a week. At all other times, and many of you who've worked with us now know, we have 24/7 staffing by physicians here at this department. In addition, I think Dr. Ambler and Renee have made themselves extremely available. So please call 813-5000 at all other times. We do have an administrator on call, and they will get it back to the appropriate person, and if necessary, you will get a call back. So if there are other questions, we would really encourage you, you can call us, but we would really encourage you to submit this. This is our email box for any types of questions. Again, we can track these better and hopefully respond to them. I know it may not be as satisfactory to be talking to a live body right away, but again, this would really help us try to compile and address, all the questions that come up. And as he has been all along, Joe is our primary contact, just for general information. I do want to emphasize he is not the primary contact for reporting cases. That really should come to the above two numbers. But if there are general questions about procedures, about the guidelines regarding schools, Joe remains your primary contact, and he's listed his email address there. And then finally, I did want to bring to your attention, we did distribute a school administrator letter, and we actually did attach that to a public health update that was distributed to all the Westchester county physicians in the county. And what we really wanted to emphasize is there's been, and I will talk a little bit more about this later, people are getting different test results. They're getting one result that's positive, one result that's negative. And what we want to really remind people of is any diagnostic positive, and I will talk about a little bit about this more in detail, is going to be considered a positive from a public health standpoint, and they will be treated as a positive case, isolated, and have a contact investigation done. But that is really to emphasize that, and I think it also gives some updated testing information. Next slide. So what are the roles and responsibilities of the health department, and what are the roles and responsibilities of the schools when there's a positive case and there's contact tracing? So again, the health department, whether it be the Westchester County or New York State Health Department, have the primary responsibility for doing contact investigations. And what this means is we basically assess each situation together with you to figure out who has been exposed and who requires testing and quarantine. And again, this is a case-by-case thing. Unfortunately, there is no black and white about this whole thing. But we will need, the school's assistance to do that. So the first thing we actually need to do, we certainly don't expect, or we would think it would not be unusual, or be rather unusual for the school to have an actual medical record of a positive COVID result. That's our responsibility. We have access to this confidential information. What we need from you in order to verify the information is we certainly need the child, or we need the staff's name, we need their birth date, and we need a phone number where we can reach, or the family's phone number, so that we can verify this. Particularly in the cases of staff, they are often not Westchester County residents, and so we need to coordinate with the state in order to get these results. So having that information when you call to report us would greatly facilitate and expedite our ability to confirm the test result. Then the second thing that we do is once we go from there, we are going to be working with you to determine who had significant contact. Now, I am just going to put it out there. I know the state uses the term close and proximate, which I think has been a big source of confusion for every person who's working on this. And I prefer the term significant contact because, as I said, it will vary on a case-by-case basis. So one of the things that I did want to go into with that is that everything that we do in public health, the goal is really to prevent the spread of COVID or prevent the spread of any disease. And then what we want to do is make an attempt to minimize, and I emphasize the word further, disruption to school operations, because I think we all recognize, none of us can imagine that there will or has been anything more disruptive than has already been. But our goal is really to try to further minimize any further types of disruption. So the other thing that I really want to say about this is everything and all of these measures are really, it's a risk-benefit analysis. There's nothing, there's no 100% guarantees in life or anything else. And the same thing is here too. And a lot of these guidelines were really written and designed in mind to try to minimize further disease spread with something that, and some of you may already argue this is not reasonable, but these were the measures that were put into place. And so the specific thing I wanted to say about this is we know all the guidelines have told us that they want everybody to keep a minimum of 6 feet apart. We're recommending that everybody mask. There is nothing magical about 6 feet. And the virus doesn't know to stop at that point. And there's nothing magical about wearing masks. Those measures were put into place to try to minimize what the likelihood of transmission would be if you get somebody who is infected. And so therefore, it doesn't mean that if you were sitting more than 6 feet away, that you cannot be infected. And so I did want to try to get that out there. The other thing I want to say, generally speaking, is that if we have a standard size classroom with a typical duration, of a class period, we are generally going to be considering those people contacts, who we are going to recommend quarantine or who we're going to quarantine and who we're going to, need to recommend testing for. There will be situations, like we've had a few situations, where we've had a very small number of people, for example, in a large gymnasium or a large auditorium, where we might decide that not all those people, and certainly for certain outdoor activities, depending on what the nature of the contact is, we might not recommend quarantine for all of those people. But again, generally speaking, if they're sharing a same standard size classroom for a typical class period, those people are likely to be considered and probably will be considered, contacts and will require quarantine. So to move on to the next thing, the health department's responsibility. So the legal authority to issue isolation and quarantine health orders rests with the health department, either the Westchester County Health Department, or it could be also the New York State Health Department. So the health department is really the only entity that can legally issue isolation and quarantine orders. So when we find out about a positive case, that will be done fairly routinely. When and they will be isolated. Just to go back, the isolation is a term, it's a public health and it's a legal term used to confine people who have tested positive or who are believed to be infected. Okay, quarantine is a term that's used to confine people who've been exposed to somebody who has tested positive. They themselves very likely do not have any symptoms, and they may not have a positive test result. So that's what we mean by isolation and quarantine. So anyone who's tested positive or who's felt to, be somebody who could be infected will be issued isolation orders. People who are exposed but asymptomatic will be issued quarantine orders. So that is fairly routine procedure for anybody who fits into those categories. Next slide. So what are the school's roles? So number one, it is reported. It's not only COVID, as most of you know. There's probably 70 or 80 diseases. If somebody has meningitis, if somebody has hepatitis, chickenpox, I think most of you are familiar, and this is nothing new. Those are reportable to your local health. And so by the same token, anybody that you hear about that tests positive for COVID, whether it's a staff, whether it's a teacher, whether it's a student, that needs to be reported to us. So, and then we can follow up with the pieces that I just described to confirm, the test results and advise you on further measures that need to be taken. What we do need is we will have to work very closely with you as the schools, because you will be the ones that have the most complete information on what that student's schedule was, whether they attended, in person, whether they were remote, what days they were there. You will be the ones who know which staff were actually in the school and who was exposed. We'll need to know the activities. We'll need to know whether or not they rode the bus, who the bus driver, the bus company, and all the staff who might have been exposed. So we will routinely need listings from the school with all of that information, listing those people, and we definitely need the contact information. What I will refer you to on the school toolkit, if you look at page C4, it lists all the elements that need to be included. And if we're not doing it already, we should be sending you an Excel spreadsheet and a template for listing all of this information. We also do need the date of birth. That is key, and one thing that's not listed in the school flow diagrams in order to be able to confirm or check up on any type of testing. If you have an email contact information, for example, for a parent or for a staff, that is also helpful. But again, we should be sending out a Excel template with all the requested information. Adhering to that template, I know some of you may have your own and have your own tools, will expedite our ability to get all these names into the system that we're using for contact tracing, and will expedite staff being able to contact all those people. And I know one of the issues that has been brought up is that people felt that perhaps contacts have not been reached, or nobody's contacted them. And one of the things that's contributing to that is not having the complete information for us to get these into the database in order to proceed with doing this. So another school role is really all the relevant communications, whether it be with your staff, with your students, with the families. And I think that's all routine pretty much for all of you. You will work, together. The county health department does not generally release public information. We would do that certainly in concert with you, but that's obviously the school's decision as to how they want to do that. We obviously would prefer that if you plan to do that, that if you let us know so that we can help support you in any of those efforts. So another major role of the school is to exclude people who are isolated in quarantine. As I mentioned before, it's the health department's responsibility, and we're the only ones legally authorized to issue those isolation and quarantine orders. We will notify you, and we should be working with you to inform you of who those people are. But then it is the school's responsibility in the interest of preventing any further transmission, and the school certainly has the authority to exclude any of such people. And so, again, we're not expecting you to isolate, quarantine, that's us, but I think we do expect exclusion of people who have been issued that, and we should be communicating that with you. So I think the other area where there's been some confusion about is once we've notified you of who needs to be isolated and quarantined, those people really should be proceeding with, or you should be proceeding with excluding these staff or students while they're waiting to receive. There may be a bit of delay due to some logistic and some technical issues, but while they're awaiting that official isolation and quarantine order, they should be excluded because they've already been identified as people who could potentially further spread the disease in your schools. And so we would ask that they be excluded. And the other question that comes back that's come up a lot is what's the clearance? And we get a lot of calls. So again, one of the routine procedures is to issue isolation and quarantine release letters. And actually, there's a little bit of a typo there. It's not the isolation and quarantine is a order. The release letters really serves as a clearance to return to school. And we would suggest that as a school, just like you would require a doctor's clearance note for somebody, with another situation to return, we would suggest that you require a copy of these isolation and quarantine release letters as clearance to go back to school, and that that certainly suffices, and you need not independently contact us because those are being issued, by us as written releases from isolation and quarantine. Next slide. Okay, so this is the school toolkit and the flow charts that all of you should have received. I'm not clear and whether or not the state health department independently held a webinar for all of the schools and walked you through it. But obviously the time precludes walking through those. But we did want to bring up what the major updates were. So the first thing, and there have been a lot of questions, or many of the questions we have received have to do with what are exclusion criteria and what permits somebody to return to school. So these flow charts were developed in response to those inquiries. And what I've done is I've listed the chart and the flow chart that has the information that we've listed here. So one of the questions that we had gotten was, well, how many symptoms? Do they have to have one symptom? Do they have any symptom? And I think the updated state health department guidance makes it clear right now that any one of those symptoms within the past 10 days would be enough criteria to exclude somebody from school. I will tell you that there's been some preliminary data information that school-age children do not necessarily present in the typical way. They could have GI symptoms, they could have a headache. And we've seen all of these in terms of them testing positive for COVID. So those symptoms are very non-specific. And the reason for the change from the 10 to the 14 days is that with the 14 days, I think in the initial guidance, they wanted, in an effort to keep things simple, they just used 14 days as the time frame for everything. But I think, as many of you may be familiar with right now, we generally feel that people are infectious within 10 days of their symptom onset or their positive test result if they don't, the date that the specimen was collected, if the person does not have any symptoms. So that's one clarification. So another clarification that we've gotten some updates on is whether or not you must have a negative test, a COVID test, in order to return to school. And I think the updated guidance, the short answer is no, that's not required. But you do need to have, so when somebody is symptomatic, they do need to be referred for a provider, evaluation and a ideally they should be tested for COVID. So they either have to have a negative COVID test or they have to have a provider note. And I think it does detail on pages A2 and B2 for, they separated out, what the requirements are for students and for staff, but they're basically identical. So there has to be an alternate diagnosis by the provider. And it can't be non-specific upper respiratory syndrome or non-specific GI syndrome. Those are not acceptable, and that is explicitly written in the guidance. So it has to say this person has chronic allergies, this person has asthma. But furthermore, it really has to say that the person has the usual symptoms of this chronic condition. If they have new or different symptoms from what they've always had, they really need an evaluation. So that is what's acceptable. So it does not need a negative test, but you do need a provider. And one of the questions that has come up with that, do the providers know this? Well, this has been distributed to every single physician in Westchester County, including all the urgent cares, hospitals. And so they certainly do have that. One thing I would really encourage all of you to do is, based on my experience, I believe most, if not all of you, have a school physician, because a lot of this, will depend on some clinical, provider judgment and familiarity, with the students or the staff. They're the regular provider. And so I would really urge you to involve the medical directors. We did invite a number of them to this webinar, so I hope they're on. But if not, I would really urge you to consult with them and get them on board and help you support providers who might not be completely clear. But you can also refer providers to the health department, and we will be happy to work with them to try to help them understand, what those requirements are. So the next change that's written in the guidance, and we've gotten a lot of questions on this, and this is on flow chart B1, is that school staff and certainly students are not considered essential for COVID quarantine purposes. Nobody is trying to say that they're not essential. I think we all agree and we all recognize that they're very essential. But for the purposes of quarantine and permitting somebody back into a school environment where somebody who could potentially become infectious could expose a significant number of people, the state health department has made the determination that that risk is not worth it. And therefore, at this time, they have deemed school staff not to be essential for COVID quarantine purposes. So those people really need to be excluded from the school. However, there's no reason they can't work from home, they can't teach remotely, or whatever their other responsibilities are. So then the last, these two requirements, and I'm going to give it a little bit of a caveat because these are probably the most significant changes to this updated guidance. And many of you will see that what the guidance states is that there's a requirement to notify your local health department of any symptomatic student or staff that does not provide a negative COVID test result or acceptable provider note within the 48 hours of symptom onset. And then, as you will recall, the previous guidance did not require reporting of symptomatic individuals. At this time, this is an issue that is being discussed by all the local health departments with the New York State Health Department. And so I think everyone recognizes that this places a significant burden in terms of reporting, both on the parts of the schools as well as follow-up by the parts of the health department. And I think all the health departments are still getting clarification from the state. So at this point, we are not, requiring that you report these to us. And the same thing, unless we find out about a rather unusual circumstance, we are not going to be, proceeding with isolating or doing contact tracing on these particular individuals. Now, the exception might be is if you get a symptomatic student who has a sibling or a household member, for example, who is known to have tested positive, that person should be tested anyway. And so if we don't get a testing result, or if you have a question about somebody like that, that is somebody we would like, to hear about, and that is somebody that we would likely then we would ask them to be excluded, or put them either on quarantine. They should be anyway. If we did get the information about another household member, that person should have been identified certainly as a contact, and they should have been put on quarantine under any circumstances. Next page. So there are a number of issues and questions that came up that might not have been addressed by the updates that I just reported. I'm going to take these maybe a little bit out of order here. So one question that we have received a lot is, what are the criteria for school closure? So the school closure, this falls into a couple different categories. So right now, the state health department, and I would just frankly say the governor, has set certain criteria for school closures. And there's a number of these. So first of all, he's saying, and this was in the original guidance that was issued this summer, that if there's a 5 to 9%, it's somewhere in between, positivity rate for the region. So if you will recall, the region is not just Westchester County, but it includes, other counties in the, lower Hudson Valley, like Rockland, Putnam, the other Orange counties, the other counties here. So that is the criteria that he set for regional. But as you guys who've been keeping up, with the media, you can see that the state is also tracking this on a much more localized level. And they've identified, for example, 20 zip codes within New York State, knock on wood, none of them in Westchester yet, that have high rates, that they have been triggering actions as low as 3%. And this really is based on a rolling average. It's not a single day, because we all know things can go up and down, from day to day. And that's really going to be determined by the governor. I am sure he will inform us, and he will inform you when he makes that decision. Now, there's no school-specific criteria, like there's no number, like it's, a certain number of students or staff, a certain percentage. There are no percentages like that are school-specific that have been issued. And so it really does depend on your school's policy. You are free to make that decision however you wish. And so I will say one very practical consideration has been, depending on who has to be excluded, do you have enough staff, to safely operate your school? And that may be the determining factor, because if you do not, then you may close your school. And that is certainly a decision, and your prerogative to make the decision. So again, that's really up to your procedures and protocols and how you feel you can operate. And I've mentioned the only kind of standardized criteria, which is really going to be coming from the governor's office. Another issue that I really wanted to cover was the COVID testing issues, because I think there really has been a lot of confusion about that, particularly with respect to the point of care rapid tests. So there are right now 2 types of these rapid point of care tests that can be done, and in which you can get your results like in 15 or 20 minutes. And we do know there's a number of places that are doing this testing right now. One of them is something that's called an antigen test, which actually detects a piece, of the virus, the intact virus, and looks for that. The second type of test is what we call a molecular test, or a nucleic acid amplification test. And that basically detects the RNA, or a piece of the RNA of the COVID virus. So there are 2 types of tests. And the real, issue here is these rapid point of care tests are not as accurate or not as good as the conventional PCR tests that get sent out or done by a hospital, which takes much longer, than 15 minutes. The much bigger issue with these rapid point of care tests is that there's a much higher incidence of false negatives. So the positives are generally accepted as good, but if they're negative, there have been a number of situations where they have turned out to be false negatives. And so what the recommendation is right now is the major benefit of these rapid tests is for somebody who's symptomatic, okay, who has a symptom, because if they test positive, it gives you very quick information about really that person should be excluded anyway, but it tells you that we need to initiate a contact investigation. Okay, the negative is really less helpful in this situation. And again, if they're symptomatic, they should be excluded anyway. We would not generally, or there's not a recommendation to do these rapid point of care tests on people who are exposed to a lab positive case. So those exposed people, they should be on quarantine anyway. They should be staying home. There's a higher risk that they could have a false negative test, and they have time to get the regular conventional RT-PCR test. So again, that would be our general recommendations, but we do not regulate healthcare providers and we do not regulate schools. We can give you the testing information that we have. So I know one of the related questions has been what kind of a negative COVID test can a school accept? And really the answer to that is it's up to you. It's up to the school. We can provide the information just like I just did, but it really is up to the school. And again, I would really urge you to consult with your medical director or with your school physician as to what you want your school policy to be. Let's see. The other thing that I think I wanted just to mention about the whole thing, and that we said before, is that if somebody tests positive, no matter what kind of test, they have a rapid antigen, they have a rapid, nucleic acid or molecular test. What we are unfortunately seeing is that a number of people seem to be getting multiple tests. We're not sure what the reason for that is, but in our letter to the school administrators and also in our, our communication that we've posted on our website and sent to all the physicians in the county, there is no indication to do a repeat test or a second test once there is a positive. Okay, that's not the case for negative. So the other policy is that New York State policy, and I will tell you that from what I'm aware of, almost every other state in the country, from a public health perspective, is going to handle these positives as if they were positives. So such individuals are going to be isolated, and they're also going to be subject to a contact investigation. Am I saying that there's any way that this could not be a false positive? No, we're not saying that. Again, this is a public health policy and directive where everyone feels that the risk of somebody who might be positive, and by far and large, the vast majority of people positive are really going to be, positive. Because again, these tests are sort of like a rapid strep test or the old-fashioned rapid, flu test. If they're positive, you can make a treatment decision, right? You're going to go ahead and give them antibiotics. But if they're negative, you really need to confirm it with another test. So that is really, like I said, it's the FDA and it's the state, health department. We don't regulate labs. We don't regulate doctors. And so all we can do is really give you the information on that. So again, this information has gone out, both the school guidance, this testing criteria to the Westchester medical community. So we're hoping to get, everybody on the same page. Another question that we frequently get, there's a lot of travel questions, and particularly if there are any waivers. So again, as you all are aware, the governor has determined that there are certain states right now. I think we're generally between 30 and 35 states. As you know, this gets updated every week on Tuesdays that have what are considered high rates. These are people with either a 10% positivity rate or they have a rate of greater than 10 per 100,000. And so those states, anybody traveling back from those states are required to quarantine for 14 days before they can go to school. So those people, again, really need to be excluded, and the same is true of staff if there's any travel, to any of those states. In addition, international travel, and I believe that is also on the updated school flow charts that were issued. Right now, any country that is subject to a level 2 or level 3 CDC quarantine or travel advisory, I should say, those states, countries, excuse me, are anyone traveling to those countries are also subject to a 14-day quarantine. Theoretically, those people are all supposed to be registered, and monitored by the state health department, staff. And but again, there really are no waivers or exceptions to this in a school setting. So again, I think we just wanted to make that clear. So going back to some of the other questions, what is a chronic condition? I really think that is the medical provider's decision, he or she or the ordering physician or treating physician, and you can clarify this, with your school physicians as to what, is a chronic condition. So the other question is if there somebody refuses, and again, I think we're separating this out. So if somebody at their healthcare provider's recommendations, and I think this is spelled out in the new flow charts, at their healthcare provider's recommendations, if they refuse to get tested, they are going to be handled as a presumptive positive, and so they're going to be isolated and they're going to be subject to a contact investigation, and they should be excluded from school. I think in part this was designed to try to motivate people to get testing. And I do want to remind everybody that there's that New York State, and we also have it posted on our Westchester County website, a link to identify a test site. And one of the things that's on there is that any test site on there that has the 1866 number, I don't recall the whole number, for the state health department. Again, we have it posted to our health department website. Those are state operated testing sites, and nobody needs to have any insurance. Nobody's going to be charged. That should not be a barrier. There are also many providers. I know the federally qualified health centers, and there are other places. So that really should not be a barrier to testing, is not having insurance, because we've heard about this too. Now, this is not to say that if you do have insurance, it won't be billed. But if you don't, or if you're underinsured, there's not supposed to be in New York State an out-of-pocket charge. I covered sort of the delay, at this point, right now. If there's somebody that even if it's not 48 hours, if you know immediately that some family or some staff is refusing to be tested, that you can tell us about right away, because again, we will then go ahead and handle those as a presumptive positive in the hopes that the person might change their mind and go ahead and get tested. I think that might be most of the issues that we had to cover, and I think we're only have 15 minutes left. The one thing I think I forgot to say was that the contact tracers, there's a little bit of a division of labor here just because of the volume that we're dealing with. And although Westchester County Health Department staff is directly responsible for interviewing cases and identifying who the significant contacts are, those list of names are generally turned over to a group of contact investigators who are basically under the oversight of the New York State Health Department. So there is a dedicated team that does that. And so again, there might be, delays in terms of getting things in. And if you don't hear, or if you're concerned about people, first of all, we're telling you to proceed or initiate, with exclusion. But we would ask you to send any questions for follow-up to that email box that I gave you, on that second page in terms of Westchester County Health Department, and we will get it forwarded to the relevant state health department people. So I think with that, Joe, we can open it up to questions.
Thank you, Dr. Wong. Very much appreciated. Dr. Hewlett has been answering some of the questions as they've come up.
Have been, and there are a couple of things I think Dr. Wong has covered just about everything. One of the things which I think we wanted to share with everyone, because a lot of questions are coming in terms of other conditions which these children and staff members might have. you should be aware that we have actually had cases of individuals with what we call chronic allergic rhinitis or hay fever. And some of these individuals have thought that their symptoms were consistent with that. And when they did undergo testing, they were found to be positive. We've also seen the same thing during the last few weeks of individuals with asthma who thought that their asthma symptoms were essentially the same as they were every other year or in other parts of the season. And those individuals were also positive. And so just, this is again, qualitative advice. It's very difficult to sort these things out. And the mere presence of a chronic condition that seems to be the same in no way rules out the concurrent presence of COVID.
Any other questions you saw that you wanted to address, Dr. Hewlett?
None specifically. I think we've tried to go through these. There was one question which I think it might be more appropriate for Dr. Amler to address. It was a question about the zip code data and rolling out the information about the case load per zip code, and I deferred that to her. And then there was another question which I didn't feel completely comfortable answering, which had to do with some of the privacy issues.
Okay. There's one other that I've seen a couple of times that have come up, and we touched on it, but I just want to make sure that it's clear. Doctor sends a student back to school after having been sent home with an insufficient return note and no negative COVID test. The school at that point has the authority to refuse that child entrance to school?
I would say yes, because the criteria is that an alternative diagnosis has been provided and that the appropriate testing, if indicated, has been done. So the school needs to feel comfortable that this child, that the children in their facility are safe and that this child poses no risk. So I would say the answer to that question would be yes. You have to feel comfortable with the answers that you're getting. And you certainly have the right to pick up the phone and have a conversation with that clinician, or have the parent have a conversation with the clinician, or refer it to the health department, and we can have a conversation with the clinician. But somebody needs to clarify it for you.
I just wanted to mention too is, I've worked with many of you before on other types of diseases. And when we've had people who were exposed to measles, or we've had measles cases, or we've had TB cases, which is another situation, and perhaps it just has to do with the volume and the change, but I don't recall any of the schools or parents or community having an issue with excluding those students. And we certainly did not issue formal isolation and quarantine orders, there. So again, I would just urge people to follow, their standard procedures for, excluding people. If somebody has a fever or diarrhea, I'm assuming most schools would exclude people. So you don't need to have an official isolation or quarantine order, in order to exclude people.
I would agree with Dr. Wong. I think she's absolutely correct. It's been done in the past, and I don't think we should be doing anything different than what we've done in the past in regards to this.
Two other quick questions I'm going to throw out there. The first one is, what is the ideal time for an individual post-exposure? What is the ideal time for them to get tested? And the other question is relative to that, an individual who is testing voluntarily without symptoms, without referral to be tested, other than the example we have is getting tested weekly because they visit an elderly parent. Does that person who does not have symptoms and has not been excluded for purposes of getting tested, do they have to quarantine each time they get tested?
So with respect to the ideal time frame, and I know that is one of the questions we got up. So as most of you know, if you get tested too early after an exposure, there's a significant chance that the test may not pick it up yet. And so it may appear to be negative. And so I do know that the school algorithms now say at least 3 days. And the recommendation that we've been familiar with has been the highest yield, or the best, chance of yield is 5 to 7 days after the exposure. So it is consistent. I have to tell you, we're still trying to get clarification, but 5 to 7 days is at least 3 days. So it's not inconsistent in terms of how that is. But we're still trying to get clarification with the state health department as to what the basis, for that 3 days is. I don't know if anybody else wants to take that answer, about, people who are routinely tested, for employment or other purposes. But I would say if they don't have, new symptoms, because generally speaking, the thinking is right now that if somebody's had a positive test and there is at least what we call short-term immunity. So if you've got somebody who's testing every week and they don't have new symptoms in any way, and that's the only reason they're getting testing is to visit or to work, like if they also have a job, we would not see any reason to have to, re-isolate and quarantine or do anything with those people. As long as it's within, and here's the thing, right now they're saying 90 days. Okay, after 90 days, they're not so sure about whether or not you can get reinfected or immune, but certainly up to the 90-day period, if they're asymptomatic and they have a repeat positive test, we're not currently recommending that those people need any kind of isolation or contact investigation.
And I would agree with Dr. Wong and just remind everybody that the real, at any point in the quarantine process, if someone becomes symptomatic, that is an indicator to try to get testing done. So just a reminder. And I did see a question, I think, on the chat asking about travel history and asking if the state or location the person is traveling to is not on the list when they leave, but is on the list when they return. Do they have to quarantine? And it is actually when you return. That is so. If you go and it's not on the list, and while you're gone, it gets on the list, expect to be quarantining when you get back.
And then the last question I think that we should take a quick look at is symptoms in the house when a child is in the residence, when a child is sent home from school, siblings, family members, how do schools handle that? That comes up over and over and over in the questions.
Yeah, so this is one of the things that we are trying to get clarification with the state. Even with their 48-hour rule, which we just to reiterate, because I did see that question again in the chat, we're not requiring or not asking for reporting of those 48 hours, because if somebody got them tested, it might not be within their control, as to what the timing is for getting that back. So even under those guidelines, the state has specified that during that period of time, the siblings, as long as they are asymptomatic and there's nobody else, in the house that's tested positive, those people could come back, because we don't want to really disrupt, their thing. But it is important, to make sure that they don't have symptoms also, and that there isn't somebody else in the house other than the symptomatic student. If there's a parent who's tested positive. And again, those are all included on the routine screening, because obviously if there is a positive in the household, those people should all be on quarantine anyway and excluded, regardless, of the situation. So it is important, to consider those screening questions when you try to make those decisions.
Okay.
And I would just remind people, if you're sick, whether you are a teacher or a staff person at a school or a parent sending a child to school, people who are sick obviously should be at home and not at school. And we repeatedly hear stories where the person was sick for 4 or 5 days, continued to work, and then ultimately got tested. I would err on the side of, if you think you have COVID, get tested, don't go to work, don't go to school, protect other people. The sooner you do that, the better.
Okay. Thank you, Dr. Amler. I'm going to let you close, but before that, I just wanted to thank everyone at Westchester County DOH, Dr. Wong, Dr. Hewlett, Dr. Amler, Julie Jones, who has helped us put all of this together. I hope that this has been helpful. Again, as a reminder, we will take this and we will edit this down into a webinar. We will circulate it, and we will also send the PowerPoint slides out shortly. But again, thank you all. And Dr. Amler, I'm going to hand off to you for a couple of quick words, and then we're out.
So I know it's confusing because my block says J.H. Jones, but I'm actually sitting at my secretary's desk because so many people signed on to this, I couldn't sign on. So she had to give me her spot. But this is Dr. Shirley Amler. I am the Commissioner of Health for Westchester County. I do appreciate all of you joining us today. I do want to thank Joseph for being the moderator for this session, Dr. Wong for her excellent presentation, and Dr. Hewlett for providing all of the answers to the many questions. We view you as very, very important partners. We are in this together. We want to make your job easier. We know you are in a very difficult situation. You're the ones on the front line with all the upset parents. And we really appreciate the position that all of this puts you in. We are here to help you and assist you and try to get everyone through this with the least aggravation possible, at the same time ensuring our children have an opportunity to get the education they deserve and remain safe at the same time. So whatever we can do as a department, as a health department, as your local health department to assist you, please let us know. We greatly, greatly value everything you do every day. So my thanks to you.